Hello India, very good afternoon to all of those joining me live on the Newsland digital page. I'm Neha. Now Karnataka continues to remain one of the worst affected COVID-19 states across the country. The state has so far registered over 8 lakh COVID-19 cases. The active cases in the state stand at 71,330, while the number of discharged patients is at over 7,27,000, while over 10,000 people have succumbed to the highly contagious disease. The worst affected districts in Karnataka are Bengaluru Urban, Mysuru, Ballari, Dakshina Kannada and many others. But what's alarming is the fact that Bengaluru Urban is the worst affected COVID-19 district in India. Bengaluru Urban contributes around 8.65% of active cases. With 3.25 active cases, percent of active cases, Mumbai becomes the second worst affected district. Bengaluru Urban has over 3 lakh positive cases and the numbers just keep on rising exponentially. In fact, the Union Health Ministry said around 35% of active cases were reported from 18 districts across the country. With the onset of winter and festive season, there is a looming fear of situation getting worse and fear of second wave also grips the entire country. Now to discuss more on this in depth, joining me over the phone line is Dr. C.N. Manjunath, who is the director of Jayadeva Hospital. Many thanks for speaking to us, Dr. Manjunath. My first question to you would be, sir, Bengaluru Urban being the worst affected district across India rings alarm bells. Despite efforts by the state government, would you tell us what isn't working?
No, actually, that was the scenario till maybe August or maybe September, okay? So, particularly in the last 3 weeks, there is a consistent decrease in the number of positive cases. There is also consistent decrease in the number of active cases also. And the fatality rate is just around 1.2, 1.3%. So whatever you are telling, that was probably relevant for the month of August and September.
So the report has just come yesterday.
That's okay, but it is a retrospective report. I think they have not taken into the consideration the present number of cases. The positivity rate, which was somewhere around 13 to 14% in the month of August and September, so now it is around 4.5%, less than 5%. So the positivity rate in Bangalore, because Bangalore city alone is conducting close to 50,000 tests per day, and we are, out of this 50,000, 2.5 to 3,000 are coming as positive. So definitely the positivity rate has come down significantly, and that is, that's a very good development and a very good sign.
All right.
Yeah.
But sir, that really does not take away the fact that Bengaluru Urban alone has over 3 lakh COVID cases.
That's okay. It's a cumulative case, but now it has started declining and showing the results.
So are you saying that the situation is better now and we need not to worry?
Yes, absolutely. Yes.
All right. So there are also reports which suggest that primary contacts are not being tested. In many cases, people are also neglecting their symptoms. Your thoughts on that?
Yeah, primary contacts. See, now what has happened in Bangalore city, even the rest of the state, the lab testing capacity is significantly increased. Somewhere in April, May, we had only about 20 labs. Today, we are close to 175 lab testing centers. And also the corporation, the Bangalore City Corporation has set up in many places the temporary labs. So primary contacts are also tested and vulnerable groups are tested in all hospitals. At admission, all patients are tested. Before procedures, they are tested. So testing, in fact, daily Karnataka is recording more than 1 lakh tests per day.
All right. Sir, given the exponential rise in the number of cases, and the kind of situation, how do you see the prospect of short lockdown of 1 to 2 days in Bengaluru Urban particularly?
No, see, that lockdown phase is over, not only in Bengaluru, for the rest of the country. So now the question of lockdown doesn't come down, but one has to follow strictly this precautionary preventive measures such as mask wearing, because still this vaccine is making sound probably in the beginning of the next year or maybe in the mid next year. So mask wearing, and people should wear masks properly also and while speaking and talking. So our people tendency is to take out mask while speaking. That is not, that purpose is defeated. So mask wearing should be compulsory, extremely important, and physical distancing is also equally important. and COVID and crowd go together. So they should avoid group meetings, they should avoid this meeting, they should avoid this get-together, they should avoid this gathering. And unfortunately, what is happening, the elections have been declared, and that is also adding to the burden, both in by-poll elections as well as some general assembly elections in the country. That is also one of the reasons for spread.
All right. So you're saying this is not the right time to conduct elections or to hold
Yeah,
elections?
absolutely, definitely.
Lastly, sir, do you see a need for perhaps better micromanagement apart from the points that you put forth of districts that are reporting higher numbers? And please tell us on what lines should there be a targeted approach?
The targeted approach, see, there are two issues. There is no replacement for testing. You have to test more and more. And that is the reason we could able to isolate them early and prevent the further spread. That is one. And other thing, people should also, it's not just the responsibility of the government alone. So the public has to cooperate, and they have to go together. The public, unless they cooperate with the government guidelines and whatever from day to day SOPs have been issued from the government, so they have to understand. And particularly when we are seeing a decline, this is the time people should be more cautious. And if they become casual and careless because number of cases are coming down, there can be a huge second surge. This is where people have to be more careful now than what used to be earlier.
Right. About that, sir, whenever, for example, I commute from office to home or home to office, I see many people out. They think that they have successfully defeated Corona or act as if there is no pandemic around. What's your word for those people? What's your word of caution for those people?
You. That's the reason these people should take it very seriously. And still, Corona is very much active, and only number of cases are coming down. And so, for next minimum 3 months, they should adhere to this physical distancing, avoid gathering, and mask wearing is extremely important. In fact, government of Karnataka is penalizing those who are not putting masks or not wearing masks properly.
All right. Thank you very much, Dr. Manjunath, for joining us with all of those important insights. Well, don't think you know the virus. Don't take the threat that COVID poses lightly. Governments across the world are trying to tackle the situation as efficiently as they can. The pandemic has wreaked havoc in the world. Be a responsible citizen. Don't let your guard down. Many thanks for watching. Keep those masks on. If at all you like this video, do not forget to subscribe News9 YouTube. Like us on News9 Instagram, Facebook as well as Twitter. Take care. Stay safe.